Foot examination. In a diabetic patient. Why foot examination in a diabetic is so important?
To find out ulcers on the foot of a diabetic patient who may not be aware of the presence of ulcer. To detect peripheral neuropathy, that is one of the microvascular complications of diabetes.
Never ignore a diabetic foot ulcer. Initial steps.
Greet the patient and introduce yourself. Explain the procedure and get consent. Wash hands. Expose patient's lower legs and feet.
Techniques to use.
1. Gait assessment. 2. Inspection. 3. Palpation. 4. Check sensation. 5. Examine the footwear.
Equipments needed.
Good lighting. Comfortable place for the patient to put their feet up like footstool. Non-sterile gloves if needed. Pin or needle.
1. Gait assessment.
Observe the patient walking. Symmetry and balance. Turning. Quick or slow or staggered. Abnormalities like a broad-based gait or foot drop may suggest ongoing Charcot joint. Both decreased speed and an increased base of gait or broad-based gait should serve as a red flag warnings for advancing neuropathy and foot ulcer risk.
2. Inspection.
Inspect legs, feet and ensure to look between toes. Check skin color. Skin may look paler or cyanosis or erythema in the case of cellulitis or ischemia. Skin may look dry, shiny or hair loss in the case of peripheral vascular diseases. Check for calluses, fissures or corn. Calluses may indicate incorrectly fitting shoes. Check for ulcers. Inspect between toes, heels and underneath legs. In the case of venous ulcers, patient may feel moderate pain to no pain, and the wound may be larger or shallow, which is associated with venous insufficiency or varicose veins. In the case of arterial ulcers, patient may feel very painful and the wound may be deep punched out appearance, which is associated with diabetes mellitus or peripherovascular diseases. Check deformities, which is caused by neuropathy. High arches, clawed toes, which is seen in Charcot's disease.
3. Palpation.
Check temperature. Cold in the case of peripherovascular diseases and hot in the case of cellulitis. Check capillary refill. Prolongation, that is, if it prolongs more than 2 seconds, it denotes peripheral vascular diseases. Check pulses on dorsalis pedis artery, posterior tibial artery, and popliteal artery. Absent peripheral pulses is suggestive of peripheral vascular diseases. Check for edema. Bilateral pitting edema seen in venous insufficiency or heart failure. Unilateral cough, muscle swelling and pain on palpation denotes deep vein thrombosis.
4. Sensation.
Mr. Rashid, I'm going to touch you with this cotton. Okay? You can feel like this. Can you feel it? Yes. So like this I'm going to touch you. So whenever I am touching you, just tell me whether it is in the left side or right side. Okay? But now you have to close your eyes. Okay? Can you close your eyes? Okay, just tell me.
Left, right, left, right, right, left.
Okay, you can open your eyes now. Okay. Ashir, now I'm going to touch you with this sharp needle. Okay. When you feel it, you please tell me. Okay. Now you can close your eyes. Okay.
Right, left, right.
Okay. Okay, you can open your eyes.
Pin prick sensation test. A disposable pin should be applied just proximal to the toenail on the dorsal surface of the big toe with just enough pressure to deform the skin. The inability of a subject to perceive pin prick sensation has been associated with an increased risk of ulceration.
5. Examine footwear.
Ensure the shoes are the correct size for the patient. Note pattern of wear on soles, asymmetrical wearing suggestive of gait abnormality. Note for any holes or material inside the shoes that could cause rubbing or foot injury.
Summarize the findings to the patient. Give health talk on importance of foot care.
Educate them about weight reduction, blood sugar control, foot care and hygiene, daily inspection of feet before going to bed, keeping the skin moist with oil or Vaseline, protective footwear with pressure relieving insoles, treat calluses early, sensory testing yearly, and early recognition of foot complications.
Thank you.